Here at AIDSview, we use something called the PrEP-to-Need ratio. What does that mean? HIV has always had a disproportionate impact on certain populations. Black individuals, for instance, make up 40% of new HIV diagnoses each year. That's 8 times more per population than white individuals. AIDSview data shows groups with high levels of HIV, including younger persons, Hispanic persons, sexual minorities, and people living in the South. That's PrEP need. That's why we need to look at not only how many people are taking PrEP, but how many people with the greatest need are able to take it. This is evaluating equity. Equity is critical to ending the HIV epidemic and saving lives. To measure whether PrEP is getting to communities that need it most, we created the PrEP-to-Need ratio, or PNR. PNR allows us to measure health equity and visualize health disparities. PNR does this with a ratio of the number of people who are on PrEP in a population compared to the number of people with new HIV diagnoses in that same population. This highlights disparities between the population's PrEP use and their HIV burden, or in other words, PrEP need. There is no ideal PNR number to aim for. Rather, we are looking for whether PNR is proportional across groups, or in other words, equitable. In a perfect world, we would obtain high PrEP coverage and see equitable use across populations. For example, putting 1,000 people on PrEP in a county with relatively low new HIV diagnoses might be a sufficient response. But putting 1,000 people on PrEP in a county with a large number of new HIV diagnoses is likely not sufficient. Manhattan in New York City has had successful PrEP scale-up, and therefore a high number of PrEP users and a high PrEP-to-Need ratio. The level of disparity in PrEP use is evident when compared to many other areas. Equity measures like PNR can be used across other disease and issue areas. Right now, AIDSview is the only platform to use this health equity measure. However, it has so much potential. Check out more PrEP equity insights on AIDSview's PrEP Deeper Look.